Hello and good evening. Welcome to this room. Sorry for being late. It's not really easy to organize this conference in such a short time, but it was a collaborative effort of the Arduino community. We are very happy to make this happen. We are very happy to have all of you here. So this track is about Arduino-based medical devices, which are not ventilators. If you're interested in ventilators, you can join room 1. You will find a YouTube link on the conference page. While in this Zoom room, we are going to talk about all the other kind of devices which are potentially useful for combating the COVID-19 pandemic. We know that ventilators are a very important device. We also know that the medical community and other communities need so many other devices, and potentially they might also need something that hasn't invented yet. So we got a number of applications in the past few days, and speakers are in this room. So I would like to start quickly so that we don't waste our time. And I would like to ask the first speaker to present their project, Yusufa Mohammadou. I will give you the ability to talk. Yusufa Mohammadou from Cameroon. The project is about the design of an oxygen concentrator based on Arduino. Yusufa? Okay, let's try with another speaker. Rohit Sharma, are you there? Rohit Sharma from the United States.
Yes. Can you hear me?
Yeah, we can hear very well. Welcome.
Thank you. So let me share the PowerPoint quickly, and I have 5 minutes, I assume. Can you guys see my screen?
Yeah, we can see your screen.
Okay, wonderful. So my name is Rohit Sharma, and I work for AITS. And our project is Arduino AI toolchain. What we offer is software and set of algorithms that make it easy for your AI algorithms to quickly deploy on Arduino devices. And in the times of need, we are offering our services for free. For anybody who needs, we are ready to join hands on COVID-19 apps. We are looking to collaborate with you. If you have an idea with passion, be it a doctor, an academician, a professional, a company, researcher, or an innovator. We will provide all the softwares, access to our data scientists, embedded professionals, guidance on firmware, hardware, and technology, and ongoing help in the development and debugging of the application. Please do join hand with us. We are looking to help you develop your application. So how is our platform helps you? One of the ideas, COVID ideas is ventilator components. You can use AI to build flow analyzer, ventilator testers, monitors, and so on and so forth. And the ideas have to come from you. We would provide all the help, the data that you would need, the software that is required, and everything to help you build the entire application. And so in detail, what do we provide? We help you with picking up the software. We do supply software setup. We let you, we would help you with acquiring the data, train the model, develop the application, compile the application, and flash the application, and also monitor the devices. Everything around Arduino is our expertise. We've been working in this area for years. And just to give you an idea what we have done in the past, we did partner with ARM to develop this simple application that helps mute population. I'm not sure if you would be able to hear the sound on this video, but let's take a look.
No, we can't hear the sound.
Okay, so it was a simple idea where by embedding sensors on your fingertips, the ASL language can be decoded into words with NLP as an AI model, and you can, and a mute person with speech impairment can talk to rest of the world. And that enables 70 million population worldwide. It's just one of the ideas that has helped the world, and we are continuously working with our partners. If you want to find more about AI toolset, here is the link, and we do provide DNN compiler and Arduino as an open source. So if you're an expert in that domain, you don't need our help. You can go ahead and use that. If you do need our help, do come back to us. We are also integrated in Arduino IDE. If you search for Deep C, you will find our library right there. And we have a number of distinguished features that make us unique at this time of the need to use AI and ML in several of your projects. So please do use us. And again, I would reiterate, join hands on COVID-19 apps. We are looking to collaborate with you with an idea and passion. We will provide all the software, access to our employees, data scientists, and embedded professionals. We will provide guidance on firmware, hardware, and technology. And we will also help you in the development and debugging of application. Please do join hands with us. Thank you.
Thank you, Rohit. So among the panelists, we also have Ravit Sharma. You both have the same last name. Are you working together somehow, or it's just a coincidence?
No, we are not working together.
Oh, okay. Okay, then thank you for your presentation. Of course, keep an eye on the chat as people are asking questions, and also I remind to all the attendees that they can ask questions in the chat in the Zoom room, or also in the Discord channel. If you join the Arduino Discord space, there is a COVID-19 channel where discussion is taking place, and we will also read the most interesting questions and ask them to the speakers during this track and during the next one. Thank you again. I would like to invite then Ravit Sharma, also from the United States. Let me just give voice to him.
Hi, there's the sound coming.
Welcome, Ravit.
Hi.
So you submitted an application about a project entitled called First Level Cough Sound Screening for COVID-19.
Mm-hmm. Yep.
Okay, tell us what's it about. Yeah, we can see you're sharing your screen.
All right. So I'll just get started here. So hello everyone. Like Alessandro just mentioned, I'll be talking a little bit about CoSpect, a first level screening for COVID-19. So what is the motivation behind this? Sort of a symptom analyzer, something that can take your cough sound or breathing sound and provide symptom analysis, as well as an individualized recommendation. Motivated by the lack of doctors, they're becoming more full by the moment as cases spike, nearly 1 million across the globe. And so we're sort of working as a first level screening that can help the public identify their symptoms in advance, as well as get individualized recommendation for how they should follow up. So the functionality is that it's a lightweight neural network that's going to be running on an Arduino Edge device, and that can generate real-time predictions.
I'm sorry, Ravit, I can't actually see the screen you're sharing.
Oh, okay.
It's stuck on the loading black screen. So maybe you can try to stop sharing and start it again.
Okay.
It's loading. I will tell you when we can see it.
All right.
Yeah, also other people are commenting that they were not able to see it. No, it's still stuck on the black screen.
Okay.
I suggest you don't go in full screen mode. with your presentation, and you just share your presentation software window directly without going full screen.
Okay. Is that better? Or?
No, we still see a black screen.
Can you share your slides?
Here, I can go ahead and share the slides on the chat.
Okay, perfect.
Right.
If you share the slides, I can try to share them myself while you speak. So please go on.
Okay. Sorry about that. Okay. So I'm on the third slide here. The functionality is a lightweight neural network that we're going to run on the edge device. If we have sort of something that can generate real-time predictions as to what do you have? Do you have a dry cough versus wet cough present in 60% of cases? Do you have shortness of breath present in 20% of cases? And sort of the idea is that it would help out patients identify what symptoms they have if they're not able to access doctors and provide recommendations. So three big advantages of this solution. First of all, and the biggest one, is that it is non-intrusive. Because it's automated and all, there's no chance of transmission of the infection via doctors or person-to-person contact. Second, it's scalable. So unlike medical professionals, which are limited in their number, there are only a finite number of doctors, and at the moment too, they're also very busy. This is a scalable solution. All you really need is a microcontroller that can run this edge technology. And number three, it's versatile. It can be placed in a variety of settings, whether it be individual testing or simply running in the background at a public facility, for example. So what is our status? We have our neural network getting it running on the Arduino Edge device so that it can make real-time edge predictions. Second, we've developed a simple web app for co-spec diagnosis, something that can just let you upload the files, upload files of you coughing or the breathing sound, and provide analysis on your variety of symptoms and the recommendation, your risk level, so on. And number three, we're reaching out to public facilities, including airports and hospitals. Slide 6, I have a video. I won't go through that right now, but please feel free to check it out. Simply our first version of the web app running the analysis. Slide 7, a roadmap for the future development. Phase 1 would be the mobile/web app, so the short-term solution, where we have sort of like in the web app, users can directly record their cough sound to get diagnostics. Following that, moving to phase 2, local and public facilities. If we can get this, up at local, for example, airports or subway stations where there's a high chance of transmission, and identify the high-risk individuals so they can self-isolate. That's the second phase. And third phase is sort of upscaling, continuing to grow and expand into various facilities. All right, slide 8, our next steps. What we're working on right now is testing and refining our model. So we're gathering additional data as it continues to become available regarding COVID-19 symptoms, and just incrementally building upon it and expanding its functionality. And second, we're hoping to continuing to make this technology useful, as I mentioned, starting with the web app and reaching out to local and public facilities. So what are we looking for? We're looking for people across the board, testers who can help us find data and refine our model, developers who can help us improve our model, add more features, manufacturers who can help us upscale the edge devices, business people to help contracts with the public facilities, upskilling advisors, regulation advisors. So we're really looking for anyone who's interested in this cause. We know this is a very proven technology. There've been papers for several years, over a decade, that can show that cough detection is a viable is a viable source of analysis for the symptoms. And so now we're really looking to put this technology into test, into use. We've been working on this for quite some time, and just would like to share this with the world and reach out to you all. Thank you for your time, and here's the contact email.
Thank you. Thank you for this presentation. So, if any panelist, any speaker who submitted the project in these days is in the chat and hasn't was not promoted to panelists, please raise your hand and we will identify you in the list of attendees. I would like to invite Yusufa Mohamedou, let's try again, from Cameroon. Can you hear us?
Okay. Hello?
Hello and welcome. We can hear you.
Okay. Thank you. And good afternoon, good evening, or good morning, wherever you are in the world. And I am really glad to join you this evening. So, yeah, so I need to share my screen, I think.
Yeah, yes, please share screen. Meanwhile,
okay.
I will remind that your speech is about your project, which is an oxygen concentrator based on Arduino.
Yes, okay. So let me just give me a minute there to share the screen. Oh, I am having.
Yeah, now we can see your face, but probably. But
yeah,
you can see your.
Okay. Yeah, I'm still looking for where to share the screen.
There is a green button.
Oh, it's the green button. Okay.
Yeah, with share.
Okay. Yes. Yes. Okay. So I just did. So I will just share. I guess
we can see it. Yeah.
Okay.
Go on.
Okay. Okay. Thank you. Okay. So maybe a little slight modification in the title there. So it is. I will be talking about the local oxygen concentrator and the analyzer system. Okay. So of course, what brings us here is the COVID-19, which is raging around the world, and especially in the developed world, but we see more and more infections in the low resource countries, especially in Africa. And the problem, I mean, in the developed world, what we usually see is like they have a lack of ventilations. So so there is this call, like this one, to like I mean, there are calls to produce or mass produce ventilators, which would be used with oxygen concentrators in order to service the patient. But the problem that we have, especially in Africa here, is that we don't even have those oxygen concentrators. Like in Cameroon here, where I am, the oxygen are delivered in terms of tanks in hospitals. And just recently, the head of a general hospital in our capital city, he said that for each patient, they had to use about at least 3 cans of oxygen each day, and which cost roughly about around $500. Okay, and $500 for a country like Cameroon, which is poor, is a little bit much. So hence this project that we have been working for sometimes ago, which is the oxygen concentrator. So the basic functioning of this oxygen concentrator is this is a simplified diagram where we have cylinders which contain the nitrate filter cylinder, which is also known as zeolite, which filters out other gases, leaving the oxygen. So connected in, as you can see here on the left, with a series of valves. So, and the compressor, which drives in, which sucks in air and passes it through the cylinders, and then it is stored in the reservoir. And we also have oxygen level indicator. So the operation of this valve is shown in according to the diagram shown on the right of your screen. So we used in the prototype that we developed, we use an oxygen sensor from from Germany that we bought, which sensors the oxygen, and then we take the signal, filters it, and then passes it through an Arduino Mega that we use in order to control the system and to display the results. So what we can see here is, so we have a series of, there is an equation that got wiped out. I don't know why, but so we measure certain values in terms of millivolts, and then we convert them into oxygen concentration. So this slide shows the overview of the system that we did, that was developed based on Arduino Mega. You can see the board on the left-hand side, and then the LCD, I mean the display, which is showing the level of oxygen, the operation. And with this system that we developed, we were able to extract oxygen between, I mean, up to around 82%, from 82% up to 98%, which is quite good. And also we can see, so this is, as you can see here, it's just something which is rudimentarily made with just materials or things that we can find here. So the important thing is this, to produce this type of system, I mean, in a week, we can produce around three components, which will go a long way in helping people or sick people in terms in this time of COVID-19 crisis. And the problem, as I said, is we lack a lot of resources. Since like the sensors, we need to buy them either from Germany or from China. And so we are trying to work, trying to get in contact with our government and other government and also NGOs to fund this project so that we can disseminate the idea all throughout Africa and other developing countries. So thank you.
Thank you, Yusufa. This is a very, very interesting project. So I'm very happy that you were able to present this to us. I have a few questions for you, yes, and also yes. I would like to invite everyone to ask their questions in the chat, as we have quite some time, so we have time to discuss with our speakers and understand their projects better. In this case, first off, I would like to understand how did you validate this project? Did you involve doctors in your team? Are you running tests in a clinical environment?
Yes, we worked with doctors because I am working at the university hospital where I am. So in the development, we worked with doctors in other places to validate before it was supposed to be used, because we had to test the before it was being used. We had to take a sample of the oxygen that was concentrated, and then test it in a laboratory. I mean, to really evaluate that concentration, and it is based on that we calibrated our system to give that concentration of that. So yeah, that's it. Okay, is there any other question? I don't know.
Sorry, I was in mute. I see Muhammad in the chat is asking you to share your contact information.
Okay.
As I think that your project can be interesting for a few other people. So if you can share your contact information either in the chat or in the presentation. Also, are you going to share this presentation as well? Other people are asking for this.
Yes, I can
or maybe a link to a website or some place where you're publishing.
Okay, I think I will share it in the Google Drive, and then I can share it with everyone.
So I would like to understand also, are you in touch with other hospitals or countries which need this kind of devices? Are you collaborating with other people?
Yeah, in terms of collaboration, yeah, I contacted some of my colleagues, biomedical engineers in certain countries like in Uganda, Kenya, okay, but they did not get back to me Also in Bangladesh, I think I contacted one a professor that I have been working with. Okay, so they were also all intrigued by the idea, but as I said, the problem is they could reproduce it there, but they are also looking for resources in order to do that. So the main problem, as I said, is really the resource.
I see. Geoffrey is asking, with this device, how many patients can be provided with oxygen at the same time?
Okay, we did not evaluate in terms of number of patients that can be evaluated, but the prototype you see here contains around, it can concentrate up to 10 liters of oxygen. So maybe based on that, we can imagine how much maybe each person can use, or how many patient can be served with one of these devices.
I have a couple more questions. You mentioned that you lack resources, so you can produce 3 of these devices every week. I guess you are referring to financial resources to buy the components, or there is also a problem with sourcing and shipping the components?
Yeah, those are the 2 actually. So the first thing is like the financial resources, and also like as I said, if we have to buy the components, we have to get them either from Europe or from China mostly. So and especially in this time where all the the airports are closed, so we might also face some difficulties in that. So those are the main issues that
okay, I have one final question. As far as you can see, do you think that the COVID-19 pandemic will increase demand for these kind of devices in African countries, especially?
Yes, of course. As I said before, like the number of cases you can see are increasing. First of all, is we did not even have means to test them. That is why I guess the numbers were low. But with the arrival of the testing kits that was donated by Alibaba's Jack Ma, so a lot of testing has been done, and is in each day, in each country, you have like more than tens of cases that are being diagnosed, and more and more of those patients will need oxygen, how can I say, therapy, or I mean, they might use this device. So I guess as time goes by, in a few weeks or months, we might really see this device will be very, very helpful in managing this crisis that we are facing.
Okay, so I think that your presentation in this conference could be useful in order to create connections with other people who might join efforts with you and make this scale. Okay, see more questions. There is a question from Luca Toldo, who is the next speaker. He's asking, how did you address the problem of energy storage?
Energy storage in terms of the power supply of the system, or I mean, if it is in terms of power, for now it's we use the mains power, it's plugged in and then it works. But in future, it was, I mean, back when we developed this device, in future we were thinking of using like alternate power supplies, like solar panels or solar power, and in order to service this equipment.
Okay.
I hope that that's...
Okay, thank you. I would like to invite Luca, the next speaker, as he has a few questions for you. So I think it's nice to create a connection and a deepening on this topic. But first, I would like to invite Massimo Banzi, co-founder of Arduino.
Hi. Yusufa, congratulations for your project. It's very nice. So,
okay, thank you, Massimo.
So if you send us an email with your details, we will ship you some boards.
Okay, thank you.
Start helping you accelerate this.
Okay, and thank you very much. And may I say that it is an honor to speak to you. I am really grateful for your support. Okay. And,
Don't worry, it's our pleasure. We are grateful that you use the Arduino to build something that's so useful for people.
Okay, thank you very much. Okay, thank you.
So Luca Toldo, welcome.
Hi, can you hear me?
Yeah, of course. So if you have a few questions for Yusufa before you start with your presentation, we can just steal a couple of minutes from the schedule. And
Sure. So Yusufa, it's a very interesting presentation. I've been using with patients the oxygen concentration particularly for COPD patients. So that seems to be, for me, it's an interesting use case. Certainly devices like your one cost are quite expensive also here in Europe. The main problem is, and their use case, as I said, is COPD. So patients which are mobile, they can walk around, they don't stay in bed, and therefore portability is an essential, it's a must-have. I was wondering, are you using a electric pump to pump the oxygen to pump the air, right?
Yes, we have an electric pump. Like
how did you resolve the problem of the noise which the pump generates? Because among COPD patients, that is a big problem.
Yes. Okay. That is something that we were not able to address at this point. Okay. What we did was to try to insulate it in a cushion, such that maybe to dampen a little bit of those noise, but. Okay. It was not that good, but okay, hello. But in our research, I mean, we were thinking that maybe we could find another pump or a compressor that could produce this, that to compress the air without much of this noise.
The other problem is the kind of compression which you use, and did you measure if the compressed air had any kind of particles, or according to the compression system, there can be oil or the membrane which is doing the compressions, which could then damage the air. Did you do analysis of the air after the compression?
Okay, the analysis that was done was mostly to find the concentration of the air. But and it's just that we did not think about this, and I think that is something that we need to work with especially with the microbiologists that you are working, who tested the air in the laboratory.
Yeah, the gas chromatography and all these kind of techniques. In order
yes, exactly.
You need to do GPC in order to check that the quality of the air is sufficient.
Okay.
Okay. Yeah, these were the main. So it's very valuable for single patients, COPD. Which means mobile patient, not restricted to a bed, which means it's very valuable. It's heavily used here in Germany, devices like that. They usually have also smaller volume. So if you look for a smaller volume, this could also be another target for your use case. Okay. Smaller volume means easier to transport and wider usability, let's say.
Okay. Yeah.
Very nice.
Thank you.
Thank you.
Okay. Thank you.
So again,
are you going to share the drawings?
What?
Are you going to share the drawings and all these things?
Yes, I'm going to share the first of all, I'm going to share the PowerPoints, and then I will try to collect all the design files that we use to share it with you.
Very good. Thank you.
Thank you again, Yusufa. Also share your contacts.
Yes.
Welcome, Luca. Also, thank you for helping us discuss this project. You submitted quite a different project about a very different issue related to intensive care. So go on.
Here in Germany. Oh, sorry, I'm having a small problem with the sharing, but I know how to fix it. So here in Germany, so a big problem is managing, or overall in Europe, the availability of screens. The availability of resources of beds or whatever resources across the country, particularly in intensive care units. Intensive care unit beds, which are very complex devices, they are relatively few, and they cannot. So they are very relatively few, and they are fairly expensive, and therefore it's difficult to access them. So it's a big problem, which is here in Europe, is to know where can I go when I need an intensive care unit. Where can I go? Where is an available such a thing? And so that was the reason why 2 weeks ago, together with my son, I came up with the idea of addressing this need with a very simple idea. I mean, everybody has knows about the dash, so the buttons by which you can order things, and unfortunately I'm having a problem with Zoom and not showing my screen. So
if you can share your presentation, I can share it for you.
Yeah, I'll be happy. So I can mail it to you, right? But
yeah.
And so what we did, we simply well, maybe I can show my. Can you see my? I can try to show my camera. Can you see my screen? Oh yes, you can see me. So we built this device, and with this device, it's simply there is an ESP there, a Node MCU ESP, and if you could share I mean, I'm sorry, and then there is a very simple button, and with this button here, yeah, you can in this moment, this device has sent a fast healthcare information message to a central database that the device was in a status active, and this information can be seen on the web immediately. And therefore, immediately, it's codified according to international standard for healthcare interoperability. And there you can monitor the status of which resources are available. And these simple ideas address all the problem of identifying where are available ICUs, intensive care units, beds, or any kind of resources which one needs to have. The video, I put up a video in a YouTube. I've shared with you the YouTube link, Alessandro. If you could put that up on your screen, that would be easier. And so this, as I said, this idea consists of a simple. So meanwhile, my son made even a smaller devices where the Node MCU is on the back. And what is sorry, it's on the back. And what is also cool is that this device is also implementing a cryptographic digital signature, which means thanks to the Arduino software environment, which you kindly provided for free, then this device also digitally signs with the RSA cryptography the message, which is then published on the public database for fast care interoperability resources, and there nobody can tap it, because the power of this small device attached to it, the easiness of programming thanks to the Arduino. Exactly. So this is a video. If you can start it, this is a called Fire EHR button. Fire means first kill interoperability. Everybody can have a look on it, and here it's a true live demonstration on how one can operate the device. And then if you scroll a bit faster, then you can see basically. So in the back in the screen there, you can see the status of a database. The database is a public database according to the FHIR, which is a standard for healthcare interoperability. And that's it basically. So we did this I did it as I mean, I'm in a software company, but I did this in my free time. together with my son, which is a computer scientist student. And then basically this address the needs of identifying quickly, easily, and online there is in the GitHub repository also all the source code, the drawings. Meanwhile, my son made a new design. And yes, so this also shows that you can do digital signature in using a simple ESP12F like this one, and that's basically that's it. This project has been presented to the German hackathon. The device is using Wi-Fi, but it has been presented at the German hackathon organized by the German government, and exactly this one. And at this page, you will see all the lessons learned from the approach, various drawings, the cryptographic aspect, and it's on devpost.com. And I'm really sorry for the screen sharing, which now didn't work due to some problem with the ZoomAs and the security of Apple, and being the first time that I use ZoomAs on this Mac. So
thank you, Luca.
That's it.
I have a question. So you presented this to a hackathon.
Yeah.
Did you get any feedback from
Yes.
the medical authorities? I mean, there is demand or potential demand for these devices.
Right. So there is demand in China. For example, I have colleagues in China. They explained me that they collected the status of the device of the available bed by hand on paper, and then it's a very tedious and non-scalable process. Obviously, this easy device, which basically consists of a Node MCU or equivalent. I mean, I simply use Node MCU because I love IoT and I love Arduino. And I had it lying around, so that I use it. And I'm really amazed because you needed to do cryptography, you need to have a Wi-Fi, obviously, and it doesn't work. You see there in this screenshot the encoding of the digital signature down there, and it's all done extremely fast without additional stuff. So yeah, there is a need. However, depends to the country which are looking into. For example, here in Germany, there are several thousand hospitals, and all of them, they have a hospital information system. And the hospital information system, obviously, it's a proprietary solution usually, and it has already the kind of a tracking of the bed. So the issue of sharing where are the beds is more of a business aspect than of a technological aspect, yeah. And however, this approach here with this small device, IoT Fire device, which is not a medical device because this is just a switch about availability of a resource, and therefore does not need to get standardized according to medical device regulation, which can be extremely time consuming. I've been working 20 years in a pharmaceutical company in R&D, and I know how regulations are very important, but obviously it takes time, and a grassroots activity or quick things they're needed. So such a device, as I said, can be used for rapidly. For example, if you look at emergency situation like are happening now in the US or in Brazil, where thousands of beds are prepared, but they don't have certainly time to track each of those beds. Obviously, one could extend this mini device with a GPS tracker or other tracking, other longitudinal, latitudinal tracking the sensors in order to have an exact on-the-spot position where is the bed available. And I haven't yet done that because obviously in GPS we know it inside a room, inside a building is not that good actually. And but obviously thanks to the good library which I have in the Arduino software development for Wi-Fi based location tracking, that is also a possibility to add on. So long story short, with this device here, we see IoT done, addressing a real need in healthcare and using the latest standard for communication, interoperability, and cryptography all on a chip. Thank you.
Thank you, Luca. Also share your contacts as people might be interested in asking for more information, and collaborating with you. So we have a Discord channel, COVID-19. We have the forum. We have the Arduino forum has a board dedicated to COVID-19 projects. So that might be a good place to share also the link to your design, so that we foster some collaboration within the community, which is the main purpose of this conference.
Sure. And thank you very much again to Arduino, to the company, and congratulations to the inventors. And thanks also for the great software which you are making available for free. It's really a power nuts. It's really amazing. Thank you so much.
Thank you. Thank you also for this. Of course, please support Arduino so that we can continue developing free software for everyone and foster this ecosystem. So now let's move on to a different topic. I would like to invite the next panelist, Nastaran Hashimi from Iran. Just let me voice them. Nastaran.
Hi, I'm Nastaran Hashimi from Iran, and I'm here to present our Arduino project, which aims to combat COVID-19. Let me share my document.
Welcome. Also, we all know that Iran is fighting COVID-19. These are tough times in our country, so.
I can't. I found it. You can see my presentation.
Not yet.
Okay. No problem. I can say by my voice.
Or if you want to share the link to the presentation or send it to me, I can share it while you're speaking, as you prefer.
I think the voice is enough.
Okay.
Okay.
Yeah.
Okay. I would start with a question that we all know the answer to. What happens to the body after contracting the coronavirus? As you know, COVID-19 mainly affects lungs. This disease is a respiratory disease, so the lungs are usually affected first. According to what doctors said, what we are frequently seeing in patients who are severely ill with COVID-19 is a condition that we call acute respiratory distress syndrome, or ARDS. ARDS doesn't happen with just COVID-19. A number of events can trigger it, including infection, trauma, and sepsis. But the point is that all of the patients who have COVID-19 have this condition. I want to say what ARDS do with the body. This condition causes damage to the lungs, which leads to fluid leaking from small blood vessels in the lung. So the oxygen saturation, the SO2 percentage in one's lungs would be lower than the normal situation. And this factor, the blood oxygen level can be used for diagnosis the ones who need to go to the doctor and they need to be checked. According to what WHO said, a below normal oxygen level is under 95. If yours is under 93, you are suspected to have coronavirus. And if it's under 90, you should visit doctor as soon as possible. So in this state, I should say that what our project is and how it can help the situation. We have made an expensive pulse oximeter with Arduino platform. So what pulse oximeter this is? A pulse oximeter device is a device that estimates the amount of oxygen in your blood. It does so by sending infrared light into capillaries in your fingers, toe, or other body parts. Then it measures how much light is reflected off the gases. So in this way, we can understand the oxygen level of the blood, and then understanding if the person is at the risk of coronavirus or not. This device, I mean, the pulse oximeter, is available in the world. But the problem is that one, it is expensive, and two, they cannot be used in the homes. And if a person wants to check if he or she is at risk of corona, they should go to hospitals or the places that are for testing, where is very polluted, and on that places the risk of getting the virus is very high. And three, in some countries, for example my country, Iran, we cannot import even medical devices and these oximeters because of the sanctions against Iran. If you know about the sanctions and that America has for us, they ban us from importing the medical devices, and so we have to make them by ourselves to save our lives. Then I want to talk about the technology and how we make this oximeter by only Arduino devices. We have made this pulse oximeter device using Arduino Nano and MAX 30100, which is the IC from.
Nasran, I'm sorry to interrupt you. It's just that
You're welcome.
we all would like to see something while you're speaking.
Yeah.
Also, people are asking for a presentation link or some visuals to better understand what you're talking about. So if you have a way to share something, and then you can continue, of course, with your presentation.
How can I email, for example, the presentation? How can I share my PowerPoint to you?
Sure, I will send you an email address in the chat, and then you can resume your speech. Sorry, everyone, but I think this will help our understanding of Nasran project.
Okay.
Here it is.
I cannot see your. Okay.
Yeah.
I will send it to you by now.
Just be patient, everyone. We are doing this for you.
Excuse me, because of the problem. I'm uploading my PowerPoint for you.
Perfect. Okay, thank you. So please go on.
Okay. Then. Okay, the technology. Our device consists of an Arduino Nano and an IC called MAX 30100. The IC that I said is a pulse oximetry and heart rate monitor sensor solution. It combines two LEDs, a photodetector, and low noise analog signal processing to detect pulse oximetry and heart rate signals. The MAX 30100 operates from 1.8 voltage until 3.3 and can be powered down through software with a negligible standby current, permitting the power supply to remain connected at all times. The wiring and also the programming parts of the. You have my voice?
Yeah, we can hear you. I just haven't received your presentation yet.
It's uploading, I think. Yeah. It's uploading now.
Okay.
The wiring and also programming parts of the device is so simple, and all of them can be found in the net. So with this IC and an Arduino, we can have a compact device that will be possible to carry out the measurements and also send the data to another device by adding a Bluetooth module. this test may be slightly less accurate, but it's very easy for doctors and people at home to perform. So we're relying on it for fast readings. You can easily build this device at your house and check, for example, your oxygen, I mean the percentage of your blood oxygen very easily and daily. So you would not need to go to doctor or hospitals for checking or for a test. Because as what our government said, something about 40% of the people who have COVID-19 in Iran get this virus from hospitals. They go, for example, they see some signs of the COVID in their cells and they freaking out and they go to hospitals to check if they have the disease or not, and then they catch the virus from the environment. So with this simple and actually inexpensive device, which I think it would be less than $50, you would save your life, maybe. So I sent this for you. I think the message sent.
Okay, well, I will share it as soon as I get it. We have a question. Have you validated your project? Huh?
How to validate it? I just said that we have tested the device in some Iran's hospitals too.
Okay. Also, there is a technical question by Luca, another Luca, who is asking, why did you use the 30100 instead of another one, since it's difficult to procure for you?
I think you know, I'm the speaker of the group. The technical ones cannot be speaking English, so they choose me to talk. But this module is used in medical needs in the world. I mean, the accuracy of it is very high. So the result will be better, and you can rely on the result of this module and what it said. So we choose this.
Okay. So thank you. I just got the presentation, so I will share it quickly just to let people understand what you've been talking about.
Yeah, this is what we have made it. And the left photo is actually the IC.
Okay, so it's based on Arduino Nano. You are currently producing this in mass quantities. So
I think not for large amounts, but we have made something about I think 300 of it for Iran users for free.
Okay. Okay. Well, thank you also for this. Also, we have a
You're welcome.
Ahead of a few minutes on the schedule. So I would like to invite, if they have something to say. There are two people in this chat who submitted their project, but they are still at a concept stage. They are Mario Milanesio and Luca Scandelli, who are working on pulse oximeters as well. So if they have something to say and comment, which can be useful for other people working on these projects, I'm more than happy to let them talk. So Mario, if you want, you can. Yeah. Welcome, Mario.
Ciao, Alessandro. Hi, Alessandro. I'm working on something like the previous girls. I don't remember her name, because I sent you my presentation. Can you share? Because I don't know how to.
It's not. It's probably not accessible. We need to be
Sorry?
authorized. You need to give me permission for that.
Oh, yeah, sorry. Okay. Nice. It should be public right now.
Okay, so please go on, and I will share.
Okay. My father has lungs problems from some years, from a couple of years. So he has he used a simple device you can find in the fourth slide. We bought, I am with my family, bought on this simple oximeter on Amazon, okay? But during this quarantine, it is very difficult for me and for my sister to get at my father's home to control if he is not so scrupulous. So sometimes he doesn't measure. He should measure every day, because his oxygen saturation is not so good, but okay, 93 maybe every day. It should be 93 every day. Sometimes it raises a little, sometimes it lowers. And if people without any problems has 97, 98, and 99, okay? So the problem is this for me, to have data and to control if my father is measuring his level, his saturation level. So I thought I can mix two things. I can mix my ability to send data to Google Sheets, because it is simple or not so difficult, and to join an MAX 3105 from a Spark Fun. You can find in the fifth slide, okay, to an ESP8266 or Maker 1000, Maker 1000. In order to send this data somewhere, I can control. This was my problem, but I thought this could be useful for doctors, because we know doctors can go. It is better doctors doesn't move from their home in order to keep away themselves from COVID. So maybe this device could be useful. I'm working on it. There are some libraries, but right now I have Pimoronis, the black one model. I think it is not so, there's not real compatibility with SparkFun library, because there are some problems getting values from pulse from the heart. So I'm trying to find the bug. Okay. Next, I will 3D print a simple case, just like this one I found on the Thingiverse, but I have to modify this because I want the device to be to work on battery, and with a small LCD or something just like this, in order to show my father the values. So my father could use this device just like the other one bought on Amazon, but data get on the cloud, so I can see just in real time, and this could be useful for doctors too. I shared simple instructables I made in the eighth slide. I made some times ago, sharing data over Google Sheets. I'm using it. It works just fine. I think maybe it would be better to use some other specific cloud services, but it was simple to get back data from Google Sheets. So right now I'm using this. That's all.
Thank you, Mario. Make sure you share your project in the forum and in the community channels of the Arduino community, so that other people who share the same need can join efforts with you. Because
okay.
Also during this track, we have seen that medical devices which can help the quality of life of people affected by COVID-19 and people around them are not limited to ventilators or devices directly attached to patients, but we also need devices that make things easier, collect information, and solve a number of problems around COVID-19, also indirectly connected to that. So thank you very much. Luca Scandelli, do you want to say something quickly, maybe, since you, yeah, if you want to, yeah.
Okay, I just attend the presentation because I was interested in these things. I don't know. I just want to. I put a link in the chat where I collect some ideas about this oximeter, because I had the same issues as Mario. To check from my house other people, and here in Italy, as Mario knows, there are not so many nurses or physicists that can go to the houses and check the patients, the people, and as Nastaran said, there is also the possibility that going to the hospital, they become ill. So I just had the same idea but my problems are where to procure the sensor, because everything is delayed due to the logistics, and this is one point. And while the second point that I wanted to suggest, if you access the link, you can see that you can even map with OpenStreetMap and UMap the level on the map, the level of the concentrations, so one nurse can I don't know how to share the screen can see in real time the situation of many say 100 patients. It depends on the situation in your country, and in real time see what happens, and the fastest route to go there and intervene if there is a real problem, if the oxygen level goes below a level.
Okay, thank you very much. There is a big interest around these projects. They are needed almost everywhere, and so I really encourage you all, Mario, Luca, but also see that Luca Toldo is commenting with technical questions about security and other technical choices. I invite you to work together in the Arduino forum.
Can I also make
yeah, Massimo.
To make a quick suggestion, because I've been looking into this topic for another project, and I would suggest that you look at the AFE 4490 from Texas Instruments. So basically, it doesn't include the infrared sensors. You have to provide infrared LEDs yourself. But it is available from a number of distributors right now in reasonable amount, and there's a number of simple design examples that you can build. So AFE 4490, exactly, that one. Check it out. There's even a company I found which sells the clip with the cable on it. They are a bit expensive because they are replacement parts for actual machines. So they cost about 90 euros, but you can get the full thing with the sensors and the cable and the connector. So, what do you mean? Sorry,
Great.
why somebody says, please stop him?
No, he is not referring to you, Massimo. Don't worry. There is some noise in the chat. But anyway, so we have a few minutes left. I would like to invite the last speaker, who is Miguel Fernandez Rodriguez. Just let me enable him. Welcome, Miguel.
Thank you.
From the Spanish maker community.
Exactly. Let me see if I find how to share the screen.
There is a green button.
Yeah, share. Yeah, of course. Okay, so this should do it. Let's see. Okay, so
we can see it.
Okay, let's see if I press F5 if you still see it. You still see it?
We do.
Good. Okay. Thank you. So I present myself. Basically, I'm Miguel Angel. As Alessandro said, I'm working at the University of Barcelona, and I'm working with the coronavirus makers. And we are basically, this is a little bit far. That's why probably I'm the last speaker, far from the Arduino, because here we don't have Arduinos. But I think that is also very important, and I hope that you agree with me after the presentation. Basically, it's about masks. So basically, open hardware, surgical and filtering masks. We've been basically developing different kind of solutions, and as you can see here, I hope that you can see my pointer. So basically, this one here is basically done with a coffee filter. It takes only 2 minutes, and this is kind of like the standard mask that everyone should have. Like this is the equivalent of the social distancing. This is something we should always wear right now. On top of that, probably you are aware of these very creative and very developed 3D printed masks, in which basically the problem is that we don't have the filters. So one thing is about the safety of using the 3D printed masks, and the other one is basically that we don't have right now a lot of stock of filters. So in itself is a challenge. So basically, as I was getting calls from basically hospitals that they were running out of masks, even in the ER room, then basically I started to search for anything that I could make for them. Then I got this solution that is called the Boston model. It was developed in the Boston Children's Hospital, and this is basically like the last resort thing that they can use the physicians in the ER room. This is really interesting in the sense that the ventilator filters, as this one, that probably all the people that is reading about the ventilators and the respirators, you are aware of this kind of filter. This is available. This is available in any hospital right now, and even the production chain is open in all countries. At least even in Spain, where we lack a lot of other things. So this one is open, and we have resources around this. The problem is about the anesthesia masks that you see here, because this is something that takes time to do, and also it is not done in so much quantities. We are never prepared for a pandemic, and then basically we wanted to give this solution, something that can be used instead of the anesthesia mask from the community. So for this, basically we developed with a team of course, involving physicians and involving designers and so. We came up with this one. So it looks very ugly, but everything there has a function. And what you can see is basically that with this one, you can already put one of these HME antiviral filters, the kind of filters that I was just explaining in the last slide. But also we are developing this for being modular with these other kind of filters that still there is some stock. It's not like there is a lot, but still there are like tens of thousands, for example, only in Spain. Everything we develop is of course open source, is open hardware, and then you can also download the models and everything in the GitHub link that you have here. Then here you can see basically this is the prototype in FilaFlex. So basically this is flexible, but this is not the way to go for ER rooms, because the FilaFlex and every other additive manufacturing, you know that there are some defects and some tolerances, and there are also even the issue of porosity in the micron scale, which I will talk in the last slide. But it's kind of very negligible in a low risk scenario, like for example, I don't know, like a police or in a supermarket. That can be good, but in a ER room where the density of viruses in suspension, because they are aerosols, they are colloids in suspension, is very high, so there is not an option to take any risk. So this is only the prototype, and we need to move for injection in rubber, in silicone, or any other material like this. No? So here you can see the proof of concept. So, one thing that many people is not aware of is that this kind of filter is already prepared for sustaining the breathing of a patient. So basically already has the ability to work as a filter in a mask. Of course, this needs to be done in collaboration with the medical workers, but with the physicians, because they are the ones that are going to use it. And if they are not basically trusting the design behind, there is no point that we are doing it. So we for sure need the input from physicians. We integrate them in the developing team. We need to go for validation. Homologation, maybe we need to do the full homologation, but at least a validation, because again, this is a very high risk environment in ER rooms. So we need to go for those tests. We really we need to quantify how much this mask is isolating from the viruses outside. It's not like we want to avoid that, but we are asking the government to take it easy in the bureaucratic part, and of course maintain all the rest of all the tests. And then, of course, one thing that I need to stress is that this is only possible if we locate and mobilize all the local industry around the injection, or even in the hospital supplies and so for locating where these filters are producing in your country. And the last slide, sorry, here. It's about I don't know, probably you are not aware, probably you are, but basically the additive manufacturing has a problem, and this is on the web already. It's about the pores. So basically the claims is that it's not easy and it's not safe to use additive manufacturing for pieces that are going to be as a filtering mask. And the reason is that indeed, when you take a look on the first layer printed on this is PLA, then you will see this kind of holes. This probably you don't see clearly, but this is the scale bar is 10 microns. So here we have holes in the range of the less than 10 microns. But of course, the virus is 60 nanometers to 140 nanometers, so there's plenty of room to go through. But the masks are not done with only one layer. They are done with several layers. So if you do the maths, in principle, as you have many layers with random pores, then it's very negligible that you have a connected path that the virus can go from one layer to the next. Again, this is something negligible in the case of low risk, like in in the street, but we cannot take even this risk in the ER room. So one solution is basically that we can coat it with any polymer. And for example, it could be that easy as coating it with Vaseline or with any cream that is not water-based but oil-based. And this is the same picture of the same kind of PLA media, but then in this one it has a PEG, polyethylene glycol layer on top, and then you see that basically it seals all the pores. And another route, it could be basically to do this kind of acetone vapor baths for ADS, or you can use THF for PLA. But this needs to be done in a very controlled way. So I would really recommend to do this only in more developed facilities like a fab lab or something like that. But again, you can see from these two SEM images that this is before the treatment with the acetone bath, and this is after. And then you can see here that the first layers are really shielding from outside, and then you don't have any more the pores. Again, I would really recommend to go for injection always in the ER room, but also consider that there are other ways that you can make the 3D printing safe also in this kind of harsh environment. I think that's it. Thank you.
Thank you very much, Miguel, for this project. Although it's not it does not involve electronics, it was still important to feature this in this conference, as many people in the Arduino community are also working with this kind of 3D printing projects, and yours is a very well thought, and your experience was very important to share with other people. So thank you, everybody. Thank you to our speakers. This track ends now. However, in a few minutes, we will move on to the next track in this room, which is dedicated to technology and manufacturing challenges. So we will also have the speakers and the guests that attended the other track about ventilators. They will also come to this room to talk and discuss how to move from a concept to production, to mass availability of this project. So technology and manufacturing challenges. We will start in a few minutes in this room.